Good day, everyone. I am Eden, and for today's video, you will be learning what you need to know about this addictive stimulant drug, cocaine. So to start, let me show you what cocaine actually looks like. So it is just like any other illicit drugs. It is actually powdery. Okay, so upon my discussion, you will be learning that cocaine is not just a commonly known misused drug, but rather it also has medical uses. So take note and listen to my discussion. So cocaine is an effective local anesthetic with few adverse effects. It acts as an anesthesia and it can be applied in various parts in our body. So for example, in our throat, in our mouth, in our nose. So this is to allow procedures or certain surgery to be done without causing any pain. So this, of course, it is given now with a proper dosage and supervision with our physician to avoid adverse effects. But here the thing is that humans abuse and misuse it. And that is how the problem starts. Also, it is a potent central nervous system stimulator that elicits a sense of excitement and euphoria. And don't you worry, for this part, I will be explaining this thoroughly on how our cocaine stimulates excitement and euphoria. It is an alkaloid salt that can be administered directly. It's either by insufflation or intravenous injection or inhaled as a vapor when smoked. Cocaine has a half-life of 30 minutes to 1 hour, so very brief and short lang. It is due to rapid hepatic hydrolysis to inactive metabolites. And take note, our cocaine has a primary product called benzoylecgonine. So these are the following associated disorder when we have acute cocaine toxicity. So it's expected to have hypertension, arrhythmia. It refers to abnormal heart rhythm. For example, or it might be too quick or too slowly heartbeat. You could also have seizure and myocardial infarction when we have this acute cocaine toxicity. So how is cocaine toxicity determined? So our physician used these following factors. The first one is the dose or the dosage of the uptake or intake of cocaine. And the second factor is route of administration. And it is known that intravenous administration has the greatest hazard as compared to smoking. So why? Of course, in intravenous administration, you are administering it directly to your veins. So that is why it has a greatest hazard as compared to smoking. Now you only inhaled lang the vapor of the smoke. So how to detect cocaine use? So this is when our primary cocaine product enters. So to detect cocaine use, we measure the primary cocaine product, which is the benzoylecgonine, in urine by immunoassay. It has a half-life of 4 to 7 hours. And take note for those users or light users lang, it can be found in their urine for 3 days only, but for those abusive or heavy users, they can be found in their urine until 20 days after their last dose. So again, for light users, 3 days, and for heavy users, 20 days. So how does cocaine affect the brain? So first, let's know the short-term effects of cocaine. So first one, loss of touch with reality, intense feelings of happiness, sweating, dilated pupils, increased heart rate and body temperature, and agitation. Now let's understand this concept first to be able to understand how cocaine affects or stimulates the feeling of euphoria and happiness. So in our brain, we have this ventral tegmentum, and this ventral tegmentum is responsible for releasing our hormone dopamine. And we already know that our hormone dopamine is a happy hormone and that it is responsible for giving you the feelings of happiness and euphoria. So this is just a quick or a brief illustration on how it's present in our system. It will bind to the dopamine transporter, and that is now the time that it will trigger the people using it. But more specifically, let's delve in deeper. So I prepared illustration for that. So please focus more in this portion. So the red ones, so these are the dopamine receptor. The blue ones, these are the dopamine transporter, and the greens, of course, this is our hormone dopamine. So okay, let's start. Take note because this is very important. So okay, our hormone dopamine is released from our presynaptic neuron, and they will travel to our synaptic leaf, and they will proceed to our postsynaptic neuron, where ang postsynaptic neuron natin, this is where our dopamine receptor takes place. So they will proceed to postsynaptic neuron. So this is in order to bind with the dopamine receptor. So once dopamine will bind to dopamine receptor, so it will now triggers the feelings of happiness, euphoria, and then you will become energetic. So that is how dopamine works. So normally when there is excess of dopamine, it will be reabsorbed back to our presynaptic neuron. So okay, so meaning if we have excess dopamine, it will be recycled back to presynaptic neuron with the help of dopamine transporter. So the dopamine transporter, as its name says, it will transport excess dopamine back to presynaptic neuron. So that is in a normal condition. But however, when there is present of cocaine in our system, it will inhibit that excess dopamine to reabsorb back to presynaptic neurons. So how? So instead na ang excess dopamine ang mag-bind sa ating dopamine transporter, so it will be inhibited by our cocaine. So ang cocaine natin ang magbabind sa dopamine transporter. So by that, the excess dopamine cannot be able to go back to presynaptic neuron. And because they cannot go back to presynaptic neuron because there will be no dopamine transporter to bind with, so they will go back to presynaptic neuron and will bind again with the dopamine transporter. So that is how when using cocaine, you will be feeling more on intense feeling of happiness again and euphoria. So again, when the excess dopamine cannot be able to reabsorb back to presynaptic neuron because of the inhibition of cocaine, so they will bind again to postsynaptic neuron in their receptor, and that is the time when we feel so much energy, feeling so alert and happy. But the thing is, it only lasts for 5 to 90 minutes. Take note. And once 5 to 90 minutes is gone or is over, so that's the time that we may be feeling so irritable, paranoid, restless, and apathetic. So bakit 5 to 90 minutes lang ang last or ang effects ng ating cocaines? So again, because the half-life of our cocaine is very short and brief lang. So that is also the effect of feeling of happiness, energy, and euphoria is only 5 to 90 minutes. And since it takes time for our dopamine to normalize, okay, of course, our dopamine is so used up. So it is expected also that it takes longer time for our dopamine to normalize. So individuals use cocaine to experience good feelings again. And since the usage of cocaine, especially if it is in improper way or abusive way, so it will cause our brain to become less sensitive to dopamine. So again, in order to experience again that effects of dopamine, so individuals require larger amounts of cocaine to experience again the effects of dopamine, and that is how acute cocaine toxicity takes place. So when you use cocaine for a larger amount just to happiness and euphoria. So as times go on, you experiencing acute cocaine toxicity, which may lead to cardiovascular issues. As I said a while ago, myocardial infarction, arrhythmia, and so on. You could also have neurological issues. That is the time when you experience anxiety and depressive symptoms, as well as also you could also experiencing gastrointestinal issues. And also, according to my research, we have this treatment, the cocaine esterase. It is actually a bacteria that used to engulf cocaine in the system of users. So how they would do it? So this cocaine esterase will be also administered in the system of our cocaine users, and it breaks down cocaine esterase and the bloodstream. But the thing is that the duration of this cocaine esterase and breakdown, when they break down the cocaine in the system of our abusers or user, is that it only lasts for 24 minutes. So therefore, it is not enough to engulf or break down all the cocaine that is present in the system of our cocaine users. So therefore, I also read some articles that scientists put mutation in this cocaine esterase. So this is to last its effectivity for about 1 to 3 days. So that would be enough for our cocaine esterase to engulf and break down all the cocaine that is present in the system of our users. So, okay, these are the following references of my discussion. So, Clinical Chemistry Principles, Techniques, and Correlations by Michael L. Bishop, Chapter 31, and also in demystifyingmedicine.com. So it is very helpful in understanding cocaine. And thank you, everyone. Again, I am Eden Mary Ian Ting, saying that too much in anything is bad. So avoid misusing of cocaine. Thank you.